have two basic things, right? First, we're going to talk about hypoglycemia. And then we'll talk about hyperglycemia. All right. Sugar is needed for your cells to have energy. So when your blood sugar drops, and in theory, when it drops below 70, we call that hypoglycemia, right? What your body does is because it needs sugar for energy, we need energy, and we don't have any because we don't have enough sugar. Your body activates your sympathetic nervous system, which is what?
Fight or flight.
Fight or flight. Now, it's important for you to understand that your understanding of fight or flight will give you all the signs and symptoms associated with hypoglycemia. Let me explain. People with hypoglycemia, they develop tachycardia. Doesn't your heart rate go up when you have fight or flight?
Mm-hmm.
The patient will develop shakiness, because that's what happens when your body goes into fight or flight. Your hands, because have you ever been so angry when you're about to fight, or you get really pissed off about something and your hands start shaking? You're like, oh my God, I'm so mad right now that my hands are shaking. Does that kind of make, that's part of your fight or flight. The patient will also develop palpitations, because doesn't adrenaline cause palpitations?
Yeah.
When you have fight or flight, you develop peripheral vasoconstriction, which makes your skin cool and clammy. Does that make sense?
No. Well, I mean, like when you're in that moment, I don't even know if you even pay attention to how your skin feels.
Well, that's the point. Like if you're about to fight, right? Haven't you ever heard of people fighting or something, and then they have these, they have an injury, but they don't even notice it until after the adrenaline kind of calms down. Mm-hmm. That happens because your body releases like endorphins, right? Which give you morphine-like symptom. But a big thing about your fingers not hurting is because your blood vessels of your hands and feet constrict. That means that they limit the blood supply to your hands and feet. And that's why you develop cold, clammy skin. Your hands get sweaty and things like that. The patient may even become diaphoretic, which is excessive sweating. Does that make sense?
Yeah.
So when you think about hypoglycemia, think about the patient has low sugar. They need energy, so they activate the sympathetic or fight or flight mechanism, and that's directly responsible for giving you your clinical manifestations of hypoglycemia. Does that make sense?
Mm-hmm.
Any questions on that so far?
No.
Think of the cells not having sugar, so they can't function. So your memory is also going to be like, you're going to have a hard time concentrating. Does that make sense?
Mm-hmm.
So a lack of concentration. Okay. Any questions on that so far?
No.
All right. So now let's talk about hyperglycemia. When the patient has high blood sugar, I'm going to draw the picture real quick. So this is the blood vessel wall. And down here, I'm going to draw, this right here represents all the body's cells. I know there's cells other places. There's even blood cells. But just for the sake of illustration, this represents your body's cells. Does that make sense?
Yeah.
And all these little dots are the nuclei of your body's cells. Now, inside the blood vessels, you have these dots, which represent blood cells, okay? This is blood cells. That's cool. But when you have hyperglycemia, your blood sugar is high, you develop a lot of sugar, and that's these dots right here. So all of these dots represent blood sugar. So much sugar in the blood. This is problematic because the sugar makes the blood, in a sense, thicker. It destroys blood vessels. It destroys nerves. You see all these yellow dots?
Mm-hmm. You
have hyperglycemia. So what your body does, remember, all your signs and symptoms are based on your body's attempt to fix the issue. It's 3:15. Can we continue?
Yeah, go ahead.
Okay, thanks. So what your body does is, since it has all this sugar inside the vessels, what it does is it starts pulling water from the cells outside. It starts pulling water so it can dilute the sugar. Does that make sense?
Which is why you're dehydrated.
Exactly. It's a huge component in hyperglycemia. I don't care how bad the hyperglycemia is, dehydration is a huge component. You have cellular dehydration, which I'm going to write down right here. Which is a huge problem because your body doesn't normally pull water from its cells. That fluid is sacred. It doesn't really touch it because that's where your fluid need to be, the intracellular compartment. So your body's pulling fluid from the cells, and now you have more water in the blood vessels. Does that kind of make sense? Which are represented by these dots now. Mm-hmm. Now, if you have more water in the vessels, aren't you going to have more water going to your kidneys?
Yes.
So that gives you your first sign and symptom. Whoops. Which is polyuria. Now, because you're dehydrated, what happens to your thirst? Doesn't it increase?
Yes.
So you have polydipsia. And since your cells are starving because all the sugar is outside in the blood vessels instead of the cells, you get hungry. And that gives you polyphagia. And that's what we call the 3 Ps. Does that make sense?
Yeah.
Okay. Now, which one's worse, type 1 or type 2?
Type 1.
And so if type 1 is worse, which is correct, how much insulin does the patient with type 1 have?
None.
So how fast do the cells starve in type 1 compared to type 2? Which one starves faster?
Type 1.
Beautiful. So I want you to understand, patients that have hyperglycemia, when they have, generally speaking, when they have very little insulin, which usually happens in type 1, the cells, they end up sending a signal to the brain. And they say, hey, I'm starving. I'm so hungry. You got to help me out. So your brain doesn't know that it's because you have diabetes. It just knows that the cells are hungry. So it's the brain says, I got you. So what it does is it takes all the muscles from your body and all the fat from your body, and it starts breaking it down. So because, we store energy in muscles or proteins and in fats. So your body starts breaking down fat into what we call amino acids, because amino acids are the building blocks of proteins, right?
Yeah.
And then it breaks down fat because they have what we call fatty acids, because those are the building blocks of fats. And yeah, what happens to the blood sugar? The blood sugar now goes up even higher, because remember, the issue is that there's no insulin, correct?
Yeah.
So in this process of hyperglycemia, when it gets really bad, when your cells start to starve, they tell your brain, I'm starving. Your brain starts breaking down fat and muscle. Now you have an increase of sugar in your blood. You also have acids in your blood. And then the byproduct of fat and muscle breakdown are known as ketones. And ketones are going to be depicted by these black dots right here. Now, one thing you should know, Miss Ashley, is that ketones and glucose destroy blood vessels. This is how patients who have diabetes end up having their toes amputated or their feet amputated, because they can no longer feel a cut and they can't heal it. So they end up developing a really bad infection and then an amputation. Is that clear?
Yeah.
So now you have this big problem where the patient has hyperglycemia. They have a lot of acid in their bloodstream, and they have ketones. This causes something called diabetic ketoacidosis. And usually the blood sugar just has to be 300 or more for them to develop diabetic ketoacidosis. Why does it keep doing that? Okay. Does that make sense?
Yeah. And that's the one where you have the fruity or spread.
Yeah. Now, right now, this patient, are they acidotic or are they alkaline?
With the 3 Ps?
The patient with diabetic ketoacidosis.
Oh.
Don't they have a lot of acid in their bloodstream?
Yes.
Because they broke down fat and muscles, which break down into fatty or amino acids. That's what causes diabetic ketoacidosis, by the way. Now, your lungs, they can get rid of an element called carbon dioxide, and carbon dioxide equals acid. So your patient with diabetic ketoacidosis, this is why they have that fruity odor, because they're getting rid of acids which smell fruity, and they have what we call Kussmaul breathing. There's 2 S's there. Kussmaul breathing is that fruity odor. They prolong their exhalation. Does that make sense?
Yes.
Okay. And that's the manifestation of diabetic ketoacidosis. Does this make sense, Miss Ashley?
It makes sense.
All
I'm going to have to try real hard to remember it, but it makes sense.
No, I recorded this part, so I'll send it to you after
okay.
after it uploads. So I'll send it to you so you can review it. That's why I recorded it, because this is, if you understand this, man, you are golden. And you don't have to know all these different intricacies. You just have to understand, oh yeah, in hyperglycemia, dehydration is a big issue. And yeah, we start breaking down fat and muscle because the cells are starving, and that's why we develop diabetic ketoacidosis.
Yeah.
Okay. Any questions, Ms. Ashley?
No.
All right, then. If that's, oops, let me see this real quick. Clear this out. Oh, did you want me to keep it? Sorry.
No, you're fine.
We're good. All right, then.